what are your priorities for how to reinvest, or in some cases, finally invest in what people in the state need?
Sure.
Yeah.
So we have a tremendous opportunity in front of us, and the Walls Flanagan budget to move Minnesota forward is really the embodiment of why the governor and I ran for this office in the first place. We are super clear that there are some folks who did really well during this pandemic, and there are others, particularly women, who have been hit really hard. Our frontline workers, our workers who've been, needing to take time off, or who've been now, unfortunately, have had to leave the workforce. And for some, that means permanently due to issues like childcare and lack of earned sick and safe time or paid family and medical leave. And so those are the things that we are focused on in the short term, making sure that folks who've been hit can get a little relief, right? Some direct cash payments to make sure that folks are feeling like they can get a little bit ahead. And when we talk about these dollars, I'm really clear what that means. That means boxes of diapers. That means additional food on the table. That means being able to pay your electric bill or your phone bill. Like this is real money for real people. But then in the long term, we have to make sure that we are investing in the systems that, frankly, we have underinvested in for a long time. So that means things like the childcare system, fully funding and forecasting the childcare assistance program, so there's no waiting list, increasing the reimbursement rate for the childcare assistance program to the 75th percentile, knowing that we're trying to meet the real costs, but also that impacts wages. And as a surprise to no one, the folks who are doing these jobs, right, are oftentimes women of color who need to be paid for this incredibly important work as the backbone, the workforce behind the workforce, if you will. Paid family and medical leave is part of our budget. You shouldn't have to choose between taking care of a new child or a sick family member and a paycheck, and then earn sick and safe time. If we have ever seen a reason to have that in place, it is this pandemic that we've all just gone through together. And then investments, of course, in education, housing, making sure there's additional support for our relatives experiencing homelessness. So we try to really make sure that this is an opportunity to invest in the future of Minnesota. And if we don't take this, chance now, we're not going to take it. So I feel this urgency, the governor does too, and that's reflected in, the budget that we rolled out. And I think as a woman, as a mom, as a child advocate, this is the budget that I have been waiting for and working towards for the last 20 years.